Oh no, you get the dreaded email. Someone in your kid's class at school or daycare is sick. You click it open to see what's going around now. Hand, foot, and mouth? What is that? What does it have to do with hands and feet? And how do you know if your kid has it? How long does it last, and what can you do to help your kid feel better? Today we'll cover all of those things and more. I'll also go over a pretty wild symptom that can present weeks after your child is feeling better, so make sure you stick around until the end. I am Dr. Mona, a pediatrician and mom. I help empower parents with easy to understand information so you can make the best choices for your children. Make sure to like this video and subscribe here to PedsDocTalk TV to stay up to date on the latest videos and new content. Hand, foot, and mouth is the name of the clinical syndrome caused by a group of viruses known as enterovirus, most commonly the Coxsackie virus. It is a common viral infection that typically affects infants and young children, most commonly in kids younger than 4 years of age. Older children and even adults can more rarely be affected, but they can get it. I got hand, foot, and mouth from my son over a year ago, and it was not a fun virus. I'd say the worst common childhood virus I've ever gotten as a pediatrician and mom. It felt like I was swallowing nails, and I had a fever too. Likely adults getting hand, foot, and mouth are those who haven't been exposed to that particular strain as a child, or their immunity has waned like it does with many other viruses, so are now getting it as adults. Most adults who get it report that their symptoms are bothersome, more bothersome to them than their child. Even so, it does improve on its own, and you can treat it the same way you treat your child, which I will go over in this video. Hand, foot, and mouth is highly contagious and often spreads quickly through child care settings. It spreads from person-to-person contact and by touching contaminated surfaces. Contact with respiratory droplets, kissing, sharing utensils, sharing toys, touching infected surfaces, and then touching your eyes and mouth spreads the virus. I usually do see seasonality of hand, foot, and mouth to spring and early summer, but interestingly, in 2021, the year that I got it, I saw it the entire year. It seems to be reestablishing itself seasonally, but the pandemic did shift when these viruses present itself. Symptoms usually start 3 to 6 days after exposure. Hand, foot, and mouth is termed that because it classically affects the hands, feet, and mouth. It typically causes sores or ulcers in the back of the throat that usually cause throat pain and sometimes feeding refusal. Fever can occur, but not always. Hand, foot, and mouth causes a blistery rash that classically involves the palms of the hands and soles of the feet. The rash is not itchy and not typically painful, although less common strains of Coxsackie virus can sometimes cause the rash to be uncomfortable. The rash can also present on the legs, arms, and buttocks. Interestingly, for younger kiddos, so your infants or younger toddlers, the first sign of hand, foot, and mouth can be a rash in the diaper area. So hand, foot, and mouth can be a misnomer as it can appear elsewhere besides the hand, feet, and mouth. It often appears like a horrible diaper rash that just came out of nowhere. Parents are putting diaper creams on these sores thinking that it's a diaper rash, and it's not improving. And then we see the small sores start to appear around the mouth, the hands, and the feet days later. I always tell my families coming in with these sores and diaper rash that just came out of the blue during hand, foot, and mouth season to monitor it for progression elsewhere. Because if we see spots crop up around the mouth, the hands, and the feet, we have our diagnosis. Rarely, these spots can be seen on the face or trunk, but like I said, some strains that cause hand, foot, and mouth can cause this. Symptoms are typically self-limited, and children usually feel better after 3 to 5 days. Because hand, foot, and mouth is caused by a virus, treatment is focused on managing symptoms and helping relieve any discomfort your child has. Focus on hydration and soft foods. Avoid spicy, acidic, or citrus foods. Cold drinks, milkshakes, and popsicles, sounds delicious, are great to help provide comfort and help with hydration. If your child isn't drinking well, I'd recommend giving pain medication like Tylenol or Motrin, whatever's age appropriate and that they can take, and offering liquids as well. This can help alleviate the pain so they want to drink and maybe even eat something. The blisters themselves do not require any special treatment. They will go away on their own in time. You can continue using any ointments you typically use for your child's skincare routine. If a rash is present in the diaper area, you can use zinc oxide ointments, which are those white ointments, for symptomatic relief if needed. But do remember that the rash will go away in time, and not necessarily because of the ointments. The rash should start to improve within 3 to 4 days and go away within 7 to 10 days. If your child is over the age of 1 and they're still in significant pain despite the remedies I just mentioned, you can also create something called magic mouthwash. This is for severe cases of pain where ibuprofen, acetaminophen, cold liquids, or popsicles just aren't cutting it. You can clear this remedy with your child's clinician before using it to just confirm that it's needed. Mix equal parts children's liquid Benadryl and Maalox or Mylanta. For kids aged 1 to 6, put a few drops of this on a cotton swab and open their mouth and dab on the sores 4 times a day as needed. These are the sores that you're able to see, not the back of the throat. Over 6 years, use 5 mLs 4 times a day as needed as a mouthwash. So your child will swish it around and they should be able to spit it out. Remember, hand, foot, and mouth is caused by a virus, so antibiotics will not help because antibiotics are for bacteria. So don't ask your clinician for a prescription for antibiotics for hand, foot, and mouth. It's best to see the clinician if you are unsure of the diagnosis. If there is a question, it's best to get clarity to make sure no other intervention is needed to help your little one recover. It's also best to see your clinician if you're concerned your child is dehydrated. If they are refusing all liquids despite the recommendations I discussed, or if they are not making tears or have stopped urinating, it's important to seek care. Finally, if the fever persists for more than 5 days and or your child just appears to worsen in that time frame, see your clinician for guidance on the next steps. If you know the diagnosis and your child is hydrated, there is no need to bring them in unless you need a doctor's note for clearance to go back to childcare. Keep them hydrated and monitor symptoms. As mentioned, hand, foot, and mouth is super contagious. So if there is a concern your child has it, it's best to pull them from a group childcare setting. They can return when they are fever-free without medications for 24 hours and they're clinically feeling better, which means they are eating, drinking close to baseline. They should be back to their typical behavior and playing as well. Also, if there are any open weeping blisters, they need to stay home until those blisters scab over. This can take up to a week, but if touched, open weeping blisters are contagious and can lead to the further spread of the condition. I generally see kids stay out at least 4 days with hand, foot, and mouth, given the symptoms and the sores. I want to stress this, that it is important to note that complications from hand, foot, and mouth are rare, but I do want to go over it so you're not scared when you hear it in the media. It's typically a self-limiting illness. The most common complication we see is dehydration due to the sores in the back of the mouth, causing feeding and drinking refusal in kids. It's important to offer fluids or popsicles or soft foods to encourage fluid intake and use pain meds as needed. Check out this YouTube video on things to monitor in a sick child. It covers what signs of dehydration to watch for in a sick kid with the virus. Very rarely, serious complications of hand, foot, and mouth can occur. These include things like paralysis, meningitis, and myocarditis. Acute flaccid paralysis is a polio-like illness that affects the nerve cells in the spinal column. It is caused by the body's response to certain viruses and presents with rapid onset of paralysis, usually in an arm or leg. Aseptic meningitis is an infection and inflammation of the fluid and membrane surrounding the brain and spinal cord. It presents with a stiff neck, severe headache, back pain, and fever. And finally, myocarditis is inflammation and weakness of the heart due to a viral illness that spreads to the heart. It presents with feeding difficulties, chest pain, shortness of breath, rapid breathing, and lethargy. Again, I want to stress that these complications are extremely rare, but you may hear about cases on the news, so I want you to hear it from me on this video that yes, In rare cases it can happen, but it is extremely uncommon. There is a less common variant of Coxsackie virus called Coxsackie virus A6 that can cause more annoying symptoms, are more impressive and diffuse, which means all over rash, longer duration of symptoms, sometimes even 1 to 2 weeks, peeling of the hands and feet and nails, falling off 1 to 2 months after hand, foot, and mouth. So whether it's with the Coxsackie A6 strain or other strains, it's common for nails to fall off or the skin on the fingertips to peel after hand, foot, and mouth. But many parents get concerned when they see this. Don't be alarmed. It can take a few months, but the nails will grow back. We don't know exactly why this happens, but it's likely due to the virus causing inflammation of the nail bed or skin cells, leading to the loss. Wash your hands regularly with soap and water and help your child do the same. Clean and disinfect frequently touched surfaces and shared items, including toys, doorknobs, and remote controls. Hand washing is really important, but if you're looking to disinfect and you have multiple children or you're a childcare facility, per the CDC, the best way to disinfect for hand, foot, and mouth disease is to first wash items with soap and water and then disinfect them with a solution of chlorine bleach, using toys as an example. You can make your own solution by mixing 1 tablespoon of bleach with 4 cups of water or using a cleaning product that contains bleach. Finally, of course, avoiding touching your eyes, ears, and mouth like any viral illness. This is largely how we introduce a virus into our system. As a parent, it's nearly impossible to remember to wash hands, not share utensils, not kiss, or wipe boogers from your sick toddlers. I know you're doing your best. So please continue doing your best with the tips that I mentioned. There you have it. Hopefully now, if you get the dreaded sick kid in daycare email, you'll know what to look out for if it is in fact hand, foot, and mouth. And if your child gets sick, how to help them feel better and what to expect with this illness. Has your child ever had hand, foot, and mouth? What worked well for them for symptom alleviation? Please leave questions or comments below. If you found this information helpful, please like and share this video and make sure to subscribe to be the first to know about new videos published here. I'll see you all next week for another video here on PedsDocTalk TV. Stay well.